This is what a relationship looks like before gonorrhea. Gonorrhea, also called the clap or the drip. At first, gonorrhea and syphilis were thought to be one disease, but then the two were distinguished in the early 20th century. In the 1930s and 40s, an effective treatment was introduced. The original treatment was sulfa drugs and penicillin, but then, by the end of the 1950s, the microorganisms started to become immune to the antibiotics used for treatment. Gonorrhea was named by the Greek physician Galen. It is the gonococcus bacterium Neisseria gonorrhea and is one of the best known sexually transmitted diseases. There are often no symptoms of gonorrhea, but it's easily spread. Women are more prone to have the infection. 80% of women have no symptoms, and 10% of men have no symptoms. However, for women who do have symptoms, they include abdominal pain, bleeding between menstrual periods, fever, menstrual irregularities, painful intercourse, painful urination, swelling or tenderness of the vulva, the urge to urinate more than usual, throwing up, yellowish or yellow-green vaginal discharge, joint pain, and skin rash. When men have symptoms, they commonly experience pus-like discharge from the penis, pain or burning feeling while urinating, more frequent urination than usual, fever, swelling, and pain in the scrotum. Most of the symptoms described are experienced in the morning. Another symptom of gonorrhea for both men and women is itching of the anus, which can cause painful bowel movements. Oral symptoms include soreness of the throat and pain while swallowing. However, 90% of the teenagers that have the oral infection experience no symptoms at all. This infection is extremely hard to recognize, so testing and protection is extremely important. Gonorrhea can infect the joints, blood, and even the eyes. For women, gonorrhea affects organs such as the uterine tubes, ovaries, and uterus, which also may lead to infertility. Pelvic inflammatory disease is also a complication that may result from gonorrhea. In men, gonorrhea can affect the testes and urethra, which may also result in infertility and epididymitis. Gonorrhea can also lead to arthritis. Since many may not realize they have the disease, it's important to get tested immediately if you have any of these symptoms. If you are pregnant, gonorrhea is a large threat. If gonorrhea is not treated, it may cause premature birth or stillbirth. The infection may also be passed to the offspring. If you have gonorrhea, you also have a high chance of having chlamydia. About half the women diagnosed with gonorrhea also have chlamydia. To be sure you have gonorrhea, or if you experience any of these symptoms, go to your nearest healthcare provider. Gonorrhea is diagnosed by examining urine or other discharge from the vagina, urethra, or anus. Swabbing is also common in order to test cell samples from the penis, cervix, urethra, anus, or throat. Most state-sponsored medical clinics will diagnose and treat STDs for free. Antibiotics are an effective treatment of gonorrhea if it hasn't spread to the bloodstream. The two main objectives in treatment are to cure the patient and notify, test, and cure the patient's sexual partners. Do not treat yourself. Leave it to a professional healthcare provider to decide the best and most appropriate treatment plan. A follow-up visit is recommended 7 days after treatment to confirm the infection is gone. The spread of gonorrhea is easily prevented. You are more at risk of getting gonorrhea if you have multiple sexual partners, have a partner with a history of past sexual diseases or infections, abuse alcohol or illegal substances, or do not use a condom during sexual activities. To prevent spreading or receiving this infection, abstain from having vaginal, anal, and oral sex. If you choose to have vaginal or anal sex, use latex condoms or female condoms every time. If you choose to have oral sex, use latex condoms or plastic barriers, such as dental dams. If you had gonorrhea and have just been treated by a professional health care provider, Don't engage in sexual activity until getting cleared at a follow-up appointment. Make sure you trust your partner and talk about the STDs and gonorrhea before engaging in sexual activities. Healthcare providers in every state in the United States are required by law to report anyone who tests positive for gonorrhea to their state board of health to make sure people afflicted get treated and their sexual partners get tested to prevent the spread of the infection.
Michael, 5 push-ups. Let's go. Do it. Just do it.
Should I do this like
You do 5 push-ups according to my count.
so? Are you doing anything this?
Get away from me, you have gonorrhea, you disgusting sicko.
This does not mean that bullying is okay.
What are you doing?
Ew, get away from me, I don't want your infections, you disgusting pervert.
And you know, I'm gonna kind of roughly doing the bullying this Friday.
No, you have gonorrhea.
These should be double bonds, and then there should be one door.
Michael, I'm sorry, you're just not going to be going to college. I mean, that's the reality.